So my name is Mr Hemanshoo Thakkar, and I'm a consultant neonatal and paediatric surgeon at the Evelina London Children's Hospital. So I guess growing up, I had always been exposed to my parents who were sort of in a medical field, and I always wanted to sort of emulate them. I wanted to be in a position where I thought I could help others. And I always enjoyed working with children in some of the jobs that I was doing when I was younger. And so I spent a lot of time in my medical school then attaching myself to pediatric patients. I also knew that I was interested in surgery, and so I was able to combine the two together and then pursue a career in pediatric surgery. So pediatric surgery is clearly unique in the sense that it combines, I think, a lot of medicine as well as surgery. And I think you need to be quite a well-rounded surgeon to be able to do this particular career. I was always strong from a medical perspective during my training, and I was interested in surgery. So I spent a lot of time attaining those additional skills in surgery. I knew that I was always interested in also working with children, but I didn't really enjoy the medical side of pediatrics. I preferred the more surgical aspects, and particularly what I enjoy in pediatric surgery is the reconstructive work that I do, and dealing with congenital abnormalities. It's also quite rewarding working with children because you get to see them through right from their neonatal period off until the time we transition them up to the age of 16 or even 18. So I get to build these relationships with families, which I really enjoy. And I like to be able to influence something for a child early on in their life and hopefully set them on a good journey for the rest of their adult life. So I think the most rewarding thing is that in general, children have the ability to heal quite well, and they tend to perform well after surgery. And I feel that that's quite a nice thing as a pediatric surgeon, being able to do a procedure and knowing that the patient is most likely to do very well. And often the surgeries that we do will be life-changing for them and put them in good stead for the rest of their life. I enjoy working with kids of all sort of ages. You know, they're obviously all unique personalities. Every day is very different for me at work. And I do enjoy that. And I also like working with my colleagues because often a lot of the work we do in pediatric surgery is multidisciplinary. And I think I really enjoy the ability to get all these teams together and work together for the betterment of our children. I would say, I think patients value most is probably the time that I can spend for them and the dedication that I have towards them. I feel I'm someone who's usually very approachable, someone who's very responsive. And I think that comes from my own experiences of being in hospital and knowing that often just being a good communicator and being there for your patients is more than a lot of the other things that they need. So I feel that's something that perhaps they will hopefully value from me a lot. I think what I value from them is the relationship and the trust that they instill in me. So I really do enjoy the ability of getting to know these families and working with them to try and improve the quality of life for the children. And that, I think, is one of the other rewarding parts of my job.